Welcome to Practical Medicine. Today's topic is fever. Before we are proceeding further with the fever, we should know about the body temperature. Temperature of the viscera and tissues of the body, that is recorded as a body temperature. The normal level of body temperature is 36.7 degrees Celsius to 37.2 degrees Celsius. Hypothalamus that maintains the balance between the heat loss and heat gain. There are two types of activity occurring inside our body. One, it is the heat loss, and another one, it is the heat gain. Hypothalamus that maintains the balance between the heat loss and heat gain. Instrument for taking the body temperature, it is known as thermometer or specifically mercury thermometer. There are two sites where we are going to measure or take the body temperature. One, it is the superficial, another one, it is the core body temperature. For recording of the superficial body temperature, we are using the site of axilla. But if the perspiration is too much, then we can use the mouth. Inside the mouth, we have to put the thermometer just below the tongue. And every site we are going to record for 1 minute. We have to place the thermometer either inside the mouth or in the axilla for 1 minute. For core body temperature, we are going to place the rectal thermometer inside the rectum. So that's the basics about the body temperature. In the medical terminology, fever, it is known as pyrexia. What do you mean by pyrexia? It is the elevation of body temperature above normal circadian variation as a result of change in the thermoregulatory center that is located in the hypothalamus. There is thermoregulatory center that is located in the hypothalamus, and here both the up and down value has been set, and between these two values our body is regulating the temperature. When this homeostasis mechanism is not working properly, then the body temperature will rise, and that the condition is known as pyrexia or fever. We know that the normal body temperature is 36.7 to 37.2 degrees Celsius. When the body temperature is around 35 degrees Celsius, the condition is known as hypothermia. When the body temperature 35 to 36.7 degrees Celsius, we can use the term subnormal body temperature. When the body temperature is 37.2 to 37.8 degrees Celsius, then we can say that mild fever. When the body temperature 37.8 to 39.4 degrees Celsius, then we can use the term moderate fever. When the body temperature is 39.4 to 40.5 degrees Celsius, then it's the high fever. And when the body temperature is more than 40.5 degrees Celsius, then we can use the word hyperpyrexia. There are different types of fever. So first one, continuous fever. Second, remittent fever. Third, intermittent fever. Fourth, relapsing fever. And the fifth, low grade fever. We are going to see each and every types of fever in detail. So the first one, continuous fever. In the continuous fever, the temperature remains elevated above normal level without touching the baseline, and the fluctuation does not exceed 0.6 degrees Celsius or 1 degree Fahrenheit diurnal variation. So here in the continuous fever, the body temperature is above the normal level. First thing. Second thing, the body temperature is not going to touch the baseline. Here it is the baseline. The body temperature is always above the baseline, and it is always above the normal level. The fluctuation above the normal level of body temperature is not exceed to 0.6 degrees Celsius or 1 degree Fahrenheit. That means the up and bottom level of the fluctuations of the rise body temperature is around 0.6 degrees Celsius or 1 degree Fahrenheit. It is not going to rise above that. Alright. So in lobar pneumonia, infective endocarditis and enteric fever, we are going to see the continuous fever. Second, remittent fever. The temperature fluctuation exceeds 0.6 degrees Celsius or 1 degree Fahrenheit, but without touching the baseline. Here in the remittent fever also, the body temperature is increased above the normal level, and it is not going to touch the baseline. But here the fluctuation between the up and bottom level is more than 0.6 degrees Celsius or more than 1 degree Fahrenheit. However, in case of continuous fever, the fluctuation is within the range of 0.6 degree Celsius or 1 degree Fahrenheit. It is not going to fluctuate more than these values. But in the remittent fever, the fluctuation is more than 0.6 degree Celsius or 1 degree Fahrenheit. Now the third, it is the intermittent fever. In the intermittent fever, the elevated temperature touches the baseline in between. So here you are seeing in the graph that once the body temperature rises above the normal level, and after some time it going to touch the baseline as well. So in the intermittent fever, the body temperature touches the baseline in between increased level of body temperature. In hectic or septic type of intermittent fever, the diurnal variation is extremely large as seen in septicemia. So here in the hectic or septic type of intermittent fever, the diurnal variation, that means up and bottom level, is extremely large, and this type of fever or the intermittent fever occurs in conditions of septicemia. Quotidian fever is a hectic fever that occurs daily. When the fever of this intermittent type or hectic type occurs daily, then it is known as quotidian fever. One thing we have to note that in the intermittent fever, the body temperature touches the baseline, but in case of remittent as well as continuous fever, body temperature is not going to touch the baseline, or normal body temperature is not going to be achieved in between the peak and bottom levels of the body temperature of the fever. Now the fourth one, relapsing fever. These febrile episodes are separated by normal temperature for more than 1 day. So here what is happening? For example, today fever happened, and the next time the fever will happen either after 1 day, 2 day, 3 day, 4 day, depending upon the cause. The fever will happen with a gap of 1, 2, 3, 4. So this type of fever, it is known as relapsing fever. Febrile episodes are separated by normal temperature for more than 1 day. So here the body temperature remains normal level. So this type of fever we are going to see in the Borrelia infection and rat bite fever. We are seeing the relapsing fever in little bit detail. So the first one, tertian fever, occurs on the first and third day. That means tertian fever. For example, the fever happened today, that is the day number 1, and the fever happened on third day, day number 3. On the second day, the body temperature remains normal level. So this type of fever, it is known as tertian fever. It is seen in the Plasmodium vivax, Plasmodium ovale and Plasmodium falciparum. Second one, quartan fever. It occurs on the first and fourth day. That means, for example, today fever occurs, so it's a day number 1, and the second time the fever will occur on the fourth day. So on the second and third day, the body temperature remains normal level. So this type of fever when happening, it is known as quartan fever. It is seen in patients of Plasmodium malariae. So that is the tertian fever and quartan fever. So here you are seeing that the gap between the two peak, it is nearly 1 day in the tertian fever. The fever occurs on the first and third day. However, in case of quartan fever, the gap is of 2 days. Here the fever occurs on the first day, and the second time the fever occurring on the fourth day. Now the third one, Paul Epstein fever. Fever lasting for 3 to 10 days. That is followed by an afebrile period of 3 to 10 days. And it is seen in cases of Hodgkin's and other type of lymphomas. So Paul Epstein fever, that means fever lasting for 3 to 10 days, followed by a febrile period of 3 to 10 days. So here the fever starts, and once the fever starts, it is continuously happening for 3 to 10 days. Here fever stops with a gap of again 3 to 10 days. After the gap 3 to 10 days, the fever again appear. So this type of fever, it is known as pale abstent fever. Fourth one, saddleback fever. Initially the fever lasts for 2 to 3 days, that is followed by a remission lasting for 2 days, and the fever reappears and continues for 2 to 3 days. And this type of fever occurs in patients of dengue. So what is saddleback fever? Once the fever starts, the fever is continued for 2 to 3 days. After 2 to 3 days, the fever becomes stopped. There is a gap of 2 days. And after 2 days, the fever again appear, and when the fever reappear, it again continue for 2 to 3 days. So this type of fever, it is known as saddleback fever. It is seen in dengue fever. Fifth one, Borrelia infection and rat bite fever. That is associated with several days of fever followed by several days of febrile period, and then the cycle repeats. So the several days, that means the days may become vary, either 3 to 10 days, 5 to 10 days, fever happens. Again fever stops for few days, and again after few days the fever happen. Again fever stops for few days, again fever will reappear. So this type of cyclic pattern of the fever happens in the Borrelia infection and rat bite fever. So in the cyclic neutropenia, that is accompanied with fever, occurs every 21 days. So in conditions of cyclic neutropenia, fever occurs at every 21 days. So there are different types of relapsing fever we already covered. The first one, it is the tertian fever. Second one, quartan fever. Third one, pale abstent fever. Fourth one, saddleback fever. Fifth one, Borrelia infection and rat bite fever. And the sixth one, cyclic neutropenia. Now the next type of fever, it is the low grade fever. It occurs at evening specifically for several days, but does not exceed 37.8 degrees Celsius at any time. That means the fever occurs, body temperature is above the normal level. But here the body temperature that is above the normal level, it is not going to increase more than 37.8 degree Celsius. So this type of fever that occur continuously, and specifically this fever occurs at the evening, it is known as low grade fever. It is present with the cases of tuberculosis. So we covered 5 different types of fever. First one, continuous fever. Second one, remittent fever. Third one, intermittent fever. Fourth one, relapsing fever. And the fifth one, low grade fever. Now the causes of fever. Infection, that is due to the bacterial, viral, rickettsial, fungal and parasitic infection. Neoplasm, that includes the commonly with the hypernephroma, lymphoproliferative malignancies, carcinoma of pancreas, lung and bone and hepatoma. In the vascular causes of fever, it includes the acute myocardial infarction, pulmonary embolism, porcine hemorrhage, etc. Traumatic causes of fever includes the crush injury. Immunological causes includes the collagen disease, systemic lupus erythematosus, rheumatoid arthritis, drug fever and serum sickness. Endocrine causes, this includes the thyrotoxicosis and Addison's disease. Metabolic causes of fever, this includes the gout, porphyria, acidosis and dehydration. Hematological causes of fever includes the acute hemolytic crisis. Physical agents that can cause the fever, this includes the heat stroke, radiation sickness. And miscellaneous causes of fever, this includes the type of factitious fever, habitual hyperpyrexia and cyclic neutropenia. When the fever happens, then how we are going to classify, how we are going to differentiate different types of fever. So first we have to see the duration of the fever. We have to note down whether the fever is of the long duration or of the short duration. So first we are going to see the long duration of fever. When the fever is of the long duration along with the abdominal pain, road spots, bradycardia then we can say that the fever is due to the typhoid. That is the most probable diagnosis we can put. At the first, we know the duration of the fever, long duration plus abdominal pain, rose spots and bradycardia. Then we can say that the fever is most probably due to the typhoid origin. When the long duration of the fever along with the headache, vomiting, neck stiffness, then that is of the meningitis. Long duration of the fever with the valvular lesions, pathology, clubbing, palpable spleen, then it could be of the endocarditis. Fever that is of long duration along with the cough, loss of weight, anorexia, then we can say that the reason is pulmonary tuberculosis. Fever with long duration that is present with the abdominal pain and past history of amoebic dysentery, then we can most probably say that the fever is due to the amoebic liver abscess. When the long duration of the fever happens with the hepatosplenomegaly as well as lymphadenopathy, then we can say that the fever is due to the lymphoma or leukemia. When the long duration of the fever occurs with the cough, hemoptysis and breathlessness, then we can say that the cause either brucellosis and other occupational hazards. So all these are the differential diagnosis of the fever when we found that the fever is of the long duration. Now when at the first we found that the fever is of the short duration, then we have to find out whether the short duration of the fever is without specific symptoms or with specific symptoms. If the short duration of the fever is without specific symptoms, then we can say that it could be of the influenza type or the cause is of the influenza. If the short duration of the fever specifically present with symptoms, then we can see on the next slide. Here, when the short duration of the fever is present with specific symptoms, that is of the viremia, progressive weight loss, high risk behavior, then we can say that it is of the HIV infection. If the short duration of fever that happens with the throat pain, difficulty in swallowing, then it could be of the tonsillitis, pharyngitis, diphtheria or infectious mononucleosis. When the short duration of the fever with rigors as well as burning micturition, then we can say that it is of the urinary tract infections. When the short duration of the fever with rigor without burning micturition, that means short duration of the fever plus rigors plus alternate day fever, then we can say that it is of the malaria. If the short duration of the fever plus rigor plus lymphedema, eosinophilia, then we can say that it is of the filariasis. When the short duration of the fever with rigors plus abscess, then we can say that the fever is due to the septicemia. Here one thing we have to note that in all of these three conditions the burning micturition is not present. Alright, so burning micturition is absent. Now here when the short duration of the fever occur with the rashes along with the history of drug ingestion, then this fever is specifically due to the drug allergy. And when the short duration of the fever that occurs with rashes without history of drug ingestion, then this type of fever specifically happens in conditions of measles or chickenpox. Which are the drugs that cause the fever? When we give drug to the patient and due to this drug effect the fever happens. So drug causing fever, that is the aminosalicylic acid, antipsychotics, amphotericin, penicillin, antihistamines and novobiocin. So all these drugs when we are going to give to the patient, then as an action the fever happens. Now which are the harmful effects of fever? First one, hypercatabolism. In this condition there is nitrogen wastage and weight loss occurs. Second thing, fluid and electrolyte imbalance, that is due to the sweating that occurs along with the fever. Convulsions and brain damage is also one of the harmful effect of the fever. Circulatory overload and arrhythmia. So all these are the harmful effect of the fever. And when fever happens, then how the settlement of the fever takes place inside our body. There are two mechanisms through which the fever settlement occurs. One, it is the crisis, and second one, it is the lysis. In the crisis type of mechanism of the fever settlement, when the fever happens, it fluctuates in a narrow range, and after the fluctuation is over, after the crisis is over, the body temperature touches to the baseline. That is of the crisis mechanism of the fever settlement. In the lysis mechanism of the fever settlement, once the fever happens, it gradually coming back to the normal level. The body temperature gradually coming back to the normal level in case of lysis type of fever settlement. So these are the harmful effect of fever as well as the fever settlement, two mechanisms, crisis and lysis. Febrile convulsions. This type of convulsions are common in infants and children less than 5 years of age, and the temperature is more than 40 degrees Celsius. In this type of febrile convulsion, the temperature is more than 40 degrees Celsius. And this type of febrile convulsions may not be a sign of cerebral disease. That means there isn't any involvement of the cerebral disease, but still the convulsion is present. The convulsion main cause is due to the high level of body temperature more than 40 degrees Celsius in infant and children less than 5 years of age. And when the high grade of the fever is followed by the convulsion, and this type of convulsion, it is known as febrile convulsions. Now the treatment of the fever. First thing, we have to relieve the symptoms. That means symptomatic relief. When the fever occurs, we have to give the drug like paracetamol so that the fever will settle or subside, and we have to find out the cause of the fever, and later depending upon the cause we have to give the treatment. I hope through this presentation now you are able to understand the fever or pyrexia. If you like this presentation, please try to share it with your friends, batch, groups and colleagues. Thank you so much everyone.